Hi, my name is Dr. Norah Ayad and I'm the Principal Dentist at Coastal Dental Care, Burleigh Waters. Today, I'm going to review Hismile's professional in-chair whitening. As a dentist, I both recommend whitening products to my patients, but I've also tried them myself. We've tried hydrogen peroxide and carbamide peroxide, as well as the take-home and in-chair versions of those. So today, we're going to put Hismile's professional in-chair whitening to the test. You've probably seen some of Hismile's products on social media with influencers like Kim Kardashian. And today, we want to see if the professional in-chair product works just as well. So Hismile make a lot of claims about how the PAP works differently to the traditional methods that have been tried and tested. And we're going to put those to the test today. We really want to see whether we can get these great results that last a long time for our patients, but also without the downsides that we've normally seen with traditional methods, such as sensitivity and also gum irritation. We're going to put it to the test. So let's take a look and see what comes in the Hismile Professional Whitening box. We can see we've got 10 jars here, which represents 10 treatments, so 10 patients. And they've also got an in-office activator, which is designed to be used a couple of minutes before the treatment. A little bit different to the syringes of hydrogen peroxide and carbamide peroxide that we're used to using in our in-office whitening. I'm curious to see how it all happens chairside and how it all flows. So I've had a look at the ingredients. We've seen what's in it. I'm really curious to put this to the test and see how it compares to our traditional whitening methods. I know what I'm going to get with our traditional whitening methods. I don't know what I'm going to get with this product. So let's test it out on me and let's find out. So at the beginning of the procedure, we're taking a preoperative shade to see where my teeth are before the treatment. So we're using the Vida Tooth Guide 3D Master Shade Guide, which is recognised around the world as being one of the most comprehensive and accurate ways of measuring tooth shade. Really interesting to use it for this to make sure that we're actually getting an accurate representation of start shade and end shade in a way that's actually measurable clinically. Taking a few photos so that we've got some comparisons for later. That's our before photo right there. Popping the special glasses on to protect my eyes from the light. Pretty similar standard procedure with in-chair whitening. And we're about to get the teeth pumised before we start. Main reason we do this is to remove any plaque or any pellicle that's actually going to prevent the PAP gel from activating onto the tooth. Rinsing it all off, getting some cotton rolls in there, mostly just to mop up any extra saliva, but also to make sure that that retractor is nice and comfortable against the gums as well. We've got the vitamin E oil there, mainly used as a protection of the gums from any heat from the light. It is quite a strong light. That's definitely something I noticed throughout the procedure. So the vitamin E oil is designed to help against any irritation from the light. And we're mixing up the treatment there. So it's placing the activator into the PAP gel, giving it a really good stir, mixing it all through. Consistency of the gel is really different to the hydrogen peroxide, and that's definitely something I noticed. And then we're popping the face shield on, again, just to protect the skin from the light. Making sure that it's concentrated onto the teeth and not scattering anywhere else. First application going on. The instructions say that you can just lather it on, very different to what we're used to with traditional whitening using hydrogen peroxide and carbamide peroxide. We're used to making sure that we actually completely seal the gums against contact with the gel. So it was really interesting. I was sceptical as to whether or not I would get any gum irritation. And that's the light being turned on and for the first session. So the flavour of the gel is definitely something that I noticed. Flavour is something we pay really close attention to in dentistry because it really adds to the patient experience. So I noticed that the gel didn't have any particularly bad or chemical sort of flavours to it. It was actually quite pleasant. So each session with the light lasted about 15 minutes. Same sort of interval that we're used to with our traditional whitening methods in chair as well. Just using the suction to remove any excess gel that was left from the first treatment before applying the next one. And applying some more gel for our round 2. They are really easy from an operator point of view because you can just pick up the gel and put it around the teeth, not worrying about whether it's in contact with soft tissues. And the light going on for our round 2. So the intensity of the light was definitely something I noticed, particularly by that second and the third round. I could feel the heat and the strength of the light. I can see why it's recommended to be set at that 70%. I think if it was set to a higher intensity, it would probably become uncomfortable in the chair to be able to tolerate. And again, using the suction just to remove any excess gel that was left behind before doing our round 3. This was the third and final round. We still had a little bit of extra gel left, and I love the flexibility of being able to do more cycles if someone's teeth were particularly resistant. And same thing with the light. There's no limit on how many light rounds that you can do with this light, whereas some of our other in-chair methods, every patient session only gives you a maximum of a certain number of cycles. So I like the flexibility here. I could go a little bit further if I wanted to, or if I needed to. So before the treatment, my tooth shade was measured as a 2M2. So not particularly yellow or particularly dark, but still enough room to move. So I was curious to see where we would end up. So I was definitely skeptical to see whether or not I'd actually get a noticeable result, particularly because that starting shade is not particularly dark. And I see that oftentimes with whitening procedures when people start at quite a light shade and there's not much room for them to go, whether or not you actually see a difference. So taking the final shade there, we landed on an OM2, which is a number 2 on the 3D shade guide. So quite a dramatic increase actually, even though I didn't have a huge amount of space to go. Really good having the comparison there of where we started versus where we finished with the 3D shade guide. So that was the immediate result. It looked pretty dramatic. I'm always skeptical with the immediate result because there's an element of dehydration that makes the teeth look more chalky white than natural white. So I'm really interested to see whether or not these results hold up 1 week later. So the main reason I wanted to wait a week was to test whether or not the results I saw at the end of my treatment would actually last. And definitely what we saw when we measured things objectively is that we still landed at that final shade, that OM2, even a week down the track. And that was really, really interesting to see and really cool to measure objectively as well. The immediate result, when I finished the in-chair procedure, I could definitely see dehydration of the teeth, which is something I'd expect from any in-chair procedure when we're there for an extended period of time and the mouth dries out. So you end up with that chalky white look that doesn't necessarily last. But even after that subsided, so 7 days later, we still managed to hold that OM2, that final shade. So I guess if we look at this journey from the start, I really wanted to put the Hismile product to the test before I was going to start recommending it to my patients. So I was the perfect vantage point to see whether it worked, whether it was comparable in terms of results to the traditional methods we use, and how long these results last. So I was really skeptical about the Hismile in-chair whitening product until I tried it for myself. The results honestly have spoken for themselves. 1 week later, still seeing the same result last, an increase in shade colour for my teeth, but also seeing no sensitivity, no gum irritation, none of the usual things that make the procedure uncomfortable for our patients. Really happy with the results, really excited to keep using it.